Everybody has a story, and the surgeon who is telling his is also sharing those of his tiny patients whose lives he has held literally in the palm of his hands.
It's an interesting life being a pediatric neurosurgeon.
Dr. Jay Wellons holds many titles, including Chief of Pediatric Neurosurgery at Nashville, Tennessee's Monroe Carroll Jr. Children's Hospital at Vanderbilt and the Vanderbilt University Medical Center. Dr. Wellons now teaches other pediatric neurosurgeons what he has seen over the past 25 years. Brain tumors, injuries, and malformation in children, with some even yet to be born.
It's probably like the size of a thumbnail. And then the spinal cord is like maybe a clipped piece of the thumbnail sitting on top, and you're dissecting that away from the skin. And so we have these amazing instruments that we use that allow us to use micro instruments inside the field, and it's just in its best times, it's just like a symphony. It's just such a neat thing to be a part of.
As complicated as his surgeries may be, speaking with distraught, worried parents is another challenge.
You have parents that are so grateful for you, and you have parents that never want to see you again.
The son of a military pilot, Dr. Wellons credits his own parents for instilling in him discipline and compassion.
I kind of feel like when my dad taught me about, how to work the problem in crisis management, I think my mom really taught me how to communicate.
And it's his ability to relate to parents as a parent himself, along with his love of writing, that makes his memoir more of a story than a medical journal. Even his good friend, country music star Brad Paisley, has chimed in with an endorsement.
What I want people to take from this is that you wouldn't believe how relatable your stories are to the layman, to the person who doesn't know a thing about neurosurgery.
Readers can even follow along on an Instagram campaign with some of Dr. Wellons' patients who are now grown up. Paisley's movie star wife is also taking part, as current or former patients tell their story with hopes of motivating and inspiring. It's their way of saying thanks to the man who gave them a future. Dr. Wellons, thank you for joining us.
Thank you, Victoria. I'm really honored to be here.
Well, we're glad that you're here in St. Louis and sharing all of this with our readers and viewers. This is a memoir in which you are also a very good storyteller and really about some of your more memorable cases. I'm curious, was it cathartic to put all these experiences in writing?
Oh, absolutely. Just the opportunity to reflect over a 20-year career was cathartic in and of itself. But the opportunity to really think back and write about some of these patients that have had such a profound impact on me. Yeah, definitely cathartic.
I want our readers and viewers to understand it's not filled with technical jargon. It really reads as a story right from the very first paragraph. So when I opened it and found that, I was like, I'm so pleased to see that. In fact, I find it interesting at the start of your book that you mentioned that it's your father who wanted to be the doctor.
Yeah.
You wanted to be a writer. Interesting.
Took me 25 years.
That's right. But it's clear that as the son of a military pilot, he had a very big impact on you.
Absolutely.
And how you performed as a surgeon. Would you please explain that without giving too much of the book away?
No, yeah. I love talking about my dad. He was an enabler in the most positive sense. I have, wonderful memories of us doing things together. He was the Air National Guard commander of the base in Meridian. And I would go up with him on occasion on the weekends and watch the F-4 jets take off. And I have just wonderful stories about sitting out on mobile patrol all day with the sergeant and watching these F-4s take off, and I was just entranced by it. And so my dad, he was just a force of nature in my life, and I hope, and I mean that in a good way. I was supposed to learn all the multiplication tables. I forgot the grade, second or third grade or second grade or something. And obviously I flew with my dad a lot. He had a Cessna that he shared and then a twin-engine plane that his business had. Well, I hadn't quite gotten the 11s and the 12s. And so we sat out on the tarmac of our little airport in Columbia, Mississippi with the props spinning until I had the 11s and the 12s learned. And then once I had them learned, then we took off.
Wow.
Yeah.
So that's the beginning of discipline.
Yes, that's the beginning of discipline. And also I think really some of the things that he did when we would go fly together. You know, I was a young boy, and 8, 9, 10, 11, 12. We'd be up there, and I would be flying. And he would just feather the props just the littlest bit, or he would trim the flaps just a little bit. And all of a sudden, I'd be looking around, trying to, get the navigation, understand where we were, and we'd start to lose altitude. And he would just sit there, and it would leave it up to me to work the problem. And that was a phenomenal impact on me, looking back, because that's what you do a lot of times in the operating room. You work the problem. You come up with a solution. And I think that's reflected maybe some in the stories of the book, just how you have to work the problem to get a solution.
It's very admirable what you and the very few people in this country do. How many neurosurgeons are there in this country?
Well, there's 250 pediatric neurosurgeons. Yeah, it's an interesting life being a pediatric neurosurgeon. You have parents that are so grateful for you, and you have parents that never want to see you again.
Yeah.
And so to have a community of people like that, I call it a bucket line. I think back to the people that had such an influence on me, and now the young men and women that are training in pediatric neurosurgery and in pediatric neurosurgery, just to have an opportunity to impact them and bring them along in these groups, these meetings to share our kind of common experience it's terrific.
Well, it would be a big fraternity, sorority, whatever you want to call it,
Yeah.
because you are such a small group doing something so specific. You're working on the brains and nervous system, central nervous system of a child, and sometimes in utero, fetus is inside the mother, and you're doing this. So it's mind-boggling in reading this, and I was kind of curious. Well, you give credit to your mentors and teachers along the way, but I never really wanted to know more about, do you practice? How do you practice on anything? And is it just by being a resident and you just do it like your dad made you do flying?
To me, it's a good bit like the old apprenticeships. All these wonderful programs across the country. We'll have a resident that rotates on the pediatric neurosurgery service, one of the usually either 15 to 24 or so residents that are part of a program. And then they work with us in the operating room, they work with us in the clinics, they see patients in the ER, they call us at night, we come in, we do cases together. They really are just joined at the hip with us. So that, to me, that apprenticeship model where, I always tell families, doing neurosurgery, it's a two-brain, four-handed thing. And what I mean by that is, sometimes you're in there operating and you have a resident or a fellow that you're with, and your hands are moving together in unison. And that's when you know that you've reached this kind of flow state, right? When you're moving to reconnect the nerve, or you're moving to take out the tumor, or you're moving to decompress the Chiari, or whatever it is that you're doing, you just have these two brains that are focused and in kind of unison, and the hands are moving together, and teaching is taking place, but it's not like, you're in another building. You're right there. You're with them, and you're doing it together.
Let's put it in perspective for those who are going to read the book, that you're talking about teeny tiny bodies in some cases.
Yeah.
So you've got these two sets of hands, if I'm understanding this right, in this little body, and I think you described the spinal cord in maybe as small as 3 grains of rice. Is that right?
Yeah, for the fetal surgery, it's small. Yeah. We wear these magnifying loops. Actually, after I turned 50, I had to get a new pair of magnifying loops because
Welcome to the club.
Yeah, it's like I needed to see even more. But yeah, and you also have micro instruments, and we have an operating microscope. We have amazing tools in neurosurgery.
So when you look back to your very first time participating, or maybe even leading your first fetal surgery, what was that like? And you talk about your hands, and weren't you shaking? That would be scary in of itself.
It's probably like the size of a thumbnail. Wow. And then the spinal cord is like maybe a clipped piece of the thumbnail sitting on top. And you're dissecting that away from the skin, you're rolling tissue over it, and then you're bringing the skin over. And so I remember the first one I did solo, just the wonder that washes over you. And when you see that, the MFM surgeons rotate the fetus in the uterus through this little window that they've opened up, and there's an arm and there's a hand, and all of a sudden there's a little bottom, there's a little fetal bottom, and then there's the back. and you're looking at this little hole with the back. And so it's
And
a
the back is
wondrous
those
time.
that back is the 3 grains of rice.
So the 3 grains of rice are the neural tissue where that spinal cord is splayed open, where you need to get it away from the skin and put it where it needs to be. It's also why so many centers now that do fetal surgery, so many centers across the country now, why it's important to me to have a neurosurgery resident or a fellow there as part of the team, because they need to get that same experience with either assisting me or our hands doing it together, because then one day they're going to go and they're going to be doing it on their own too. And so it's really important to me that a neurosurgery fellow or resident is part of the operation so that they can experience that.
So the parents come in, they have this option of fetal surgery versus waiting till after the baby's born. Is there an advantage for either one? And
Yeah.
how do you make it so that the parents do the fetal surgery? Because that seems really risky.
Well, this is when I go back to the epidemiology degree. You know, I say, I think it was Walter Deming that said, without data, you're just a person with an opinion. And I just try to explain it in a way that people understand. And if they don't understand it, then we'll go back and do it again, you know, and talk about what the benefits are. And I think that people and patients are smart enough to know the data. So I talk about, here are the numbers. If you guys do not do surgery, now the numbers are, here's the chance of having this occur and that occur. If you do surgery, here's a proportion. Now, there is risk to the fetus. There is risk to the uterus. There is risk to mom. I understand that if you're risk averse, we can give the closure 3 days later, and the baby, this will tend to be the outcome. But this is what happens if we do it in utero. So I just feel like the way that I try to counter anxiety is with data, and is with making sure the people at whatever level they enter in, and it really doesn't matter if it's fetal surgery or brain tumor surgery or Chiari surgery or whatever it is, if to take the time in more than 15-minute aliquots that you're given in modern medicine to make sure they understand.
One of the things you do in the book is you kind of take each chapter and you offer different cases. I guess those are the most memorable ones for you.
Yeah.
To talk with one here. You take a team to Australia. They'd asked you to come to that continent because they were doing their first ever. So you go there with your team to do that. So was that just pretty much status quo?
Well, it was a remarkable experience. And without giving too much in the weeds, there was a remarkable study that came out approximately 10 years ago that showed that fetal surgery really showed a benefit for children with spina bifida. Spina bifida is where the spinal cord is exposed. And it happens so early in pregnancy, around the 13th or 14th week. It's oftentimes before women even know they're pregnant. And that's why we want women of childbearing age to take folate, right? For once the baby was born, then in the first 48 to 72 hours, a surgery would be done to close the back. So here we are in Australia. It's on a Sunday, so they're using it when there's not elective cases. There are all the other ORs. They've got set up with closed caption TV circuits, and people that work at the hospital have put on scrubs, and they're there. And they are there that day because they just want to be able to touch it. They want to be near it. They want to be a part of it. And this whole, like the eye of the Australian medical community is on this one Mater hospital in Brisbane, Australia. And we come to this point and we're getting ready, the fetus is rotated, and we've got the 3 grains of rice, and we dissect it out, and we begin the process of closing it. And we do all the things you need to do to get it closed, and it comes time to put that last little line of stitches in. And the nurse hands me the little needle drivers, and I say, no, this is Martin. Martin Wood was the name of the Australian Pediatric Neurosurgeon. So it's his hands putting it together, and it's his hands closing it. And that's important to us, that we didn't just come in and do it and walk out, that we did it, and that we did it with the team together.
You bring a lot of emotion into this book. That's why I asked if it was cathartic for you, because it's like you're looking back and realizing maybe more about how you felt at the time. You might have realized it then, but just to put it down into words, you stay in touch with some of these patients.
Yeah.
And why do you do that?
Well, I mean, to some extent you do, because you got to make sure their wounds are healing okay, and you got to make sure that their scans are clean. I mean, there's nothing like I learned a long time ago that when you walk in and you've got somebody who's had a a benign brain tumor removed, and they had their yearly follow-up scan. That is the most important thing to them in their life at that moment. So if I walk in the room, I'm like, hey, how we doing? How's school going? How's it? Like, wow, like there's like first thing you say, scan looks clean. Or my patients can tell it on my face, like there's an issue, we're going to be able to deal with it, you know. But I just think, you know, you can't help but have these kind of shared, you know, it's like an emotional metronome. You know, it's these high highs and these low lows. You know, the tumor is back. That's gut wrenching. The tumor is still gone. That's such joy, you know, to walk with your parent. I mean, with your parents too, but with your patients.
Because, and I want to talk about the parents, because as a young parent, my husband and I went through this with our firstborn. Due to St. Louis, she had to have open heart surgery. She's 14 months old. We didn't know anybody, but we put all of our faith into our pediatric cardiologist. So I get where the parents are coming from emotionally, and it is such a relief when the doctor walks through the door, and it is all business. You just want to know, did they survive? Are they going to be okay? Can they lead the rest of their lives? That's all we care about. Yep. And that's such a relief for us to hear that, yes, they can. And you've had to tell others differently as well along the way. Yeah. It's something that we don't ever forget. And obviously you don't forget the good and the bad.
No, you don't. You know, there are difficult conversations to have with families before surgery and after. I have a memory of one young couple whose infant daughter had a ruptured brain aneurysm. And she basically died twice and was able to be brought back, but ultimately we needed to get her to the operating room. And I remember, you know, just a lovely couple, and they just, you know, when I walked in, you know, she had stabilized enough to get her to the operating room. And when I walked in, the couple was, you know, like, okay, so, you know, where are you from? Tell us. I was like, guys, I'm sorry, like, this is not a sit-down conversation. Like, we have to go now, right now. And so we went to the OR, we found the aneurysm, we clipped it. You know, she woke up. You know, I went to tell the family that, you know, everything had been okay. And I, you know, it was early in my career. I remember saying, you know, she was like, can I give you a hug? I said, yes, you can give me a hug, but we really need to have a good hug like 5 years from now, you know, when we see where she is. And so at the 5-year mark, you know, had a good hug. Aww. So, you know, I think it's about these conversations that you have that are so hard, but then reflecting back on it, then what happens is it's this community that forms around people. And, you know, when you have it happen to you or your child or your friend, you can see that community form as well. So
true. Well, obviously Random House has felt that from your book and from speaking with you, because they've got, now that we have social media out there, that's come into foray, that didn't happen early in your career, they are following and posting on Instagram pictures from your patients and their reactions to the book or their stories. Yeah. So all of us can follow along. It's really neat.
Yeah, it's really neat. It was really brilliant. Ayelet Durant was the person at Penguin Random House who she's a marketer for social media, and it was her idea. And the moment that she talked about it, it just was brilliant. And one of the cool things, Victoria, is, you know, when I wrote this book, you know, there is a whole set of laws that keeps us from talking about patients, appropriately so. Like, I don't want people talking about my medical history unless I'm okay with it, you know, and so, you know, I talked to the vast majority of families in this book, or patient when they're old enough. And the ones that I couldn't reach or I couldn't get in touch with, I changed enough information to keep it from being identifying, the gender or sometimes the age. But the reality of it is that's pretty few and far between. And every single parent or patient that I talked to said, absolutely yes, please tell our story. And so then when Penguin Random House had this wonderful idea to help kind of augment the book with how people are now, I mean, there's just, people could not have been more excited about it. I mean, all week that Random House has been putting this out, and we've been putting this out on the official Instagram, you know, all that moves us _official. You know, the parents have been like, is it out yet? When's it coming out? When's our slides coming out? Oh my gosh, it's so good. And then they post it, and then people see it. And it's just this, it's just a lot of joy. And
its own network, really.
It's just its own network. And then, you know, this wonderful young girl, Delayla, who had a grade 4 tumor who ultimately passed away. Her mom, Leslie, and I are still close. And so, she agreed and wanted it. And so when I texted her and I said, hey, Delilah's page is up today. And we just had the nicest exchange, and just to see those wonderful pictures of her and just how happy and vibrant she was. It's the way the family wants to remember her. This is the most challenging aspect of pediatric neurosurgery, the constant sense of impending calamity that spills over into your life outside work. Over the years, you become so conditioned to emergencies that the random becomes the reliable. One minute it's popcorn and Harry Potter with the family, and then suddenly your daughter has the worst headache of her life and seizes from a brain hemorrhage. Or a child eating breakfast before school slumps down into their cereal, the parents believing it's a gag, until the terrible realization dawns that it's not. Brakes on a bike that fail, and into traffic your 13-year-old goes. A father who turns his head while driving just to make sure his 2-year-old's car seat harness is on correctly, then runs off the road into a tree. 2 days later, he and his wife, still in neck braces and wheelchairs from the accident, have to make the decision to take their child, never to recover, off the ventilator. These all roar at me in what must be normal moments for everyone else. A car seat was not just an inconvenient safety chore. It became as important to me as the moment the technicians would secure the Apollo astronauts into their safety harnesses before launch. Seeing my son jump helmetless onto a friend's skateboard spontaneously triggers memories of open depressed skull fractures rushed into the OR at 2 o'clock in the morning, someone's child's blood saturating my scrub pants all the way through until the material is pasted on my skin. Every moment in the car, every meal together, every time my children leave the house, if I let myself slide, I see the jaws of life, or a seizure, or a policeman knocking on my door.
You also are real in the book, too. Not everything's pie in the sky and a happy outcome. Right. Yeah. And you talk about those instances, and even a threat on your life on one of them, which we don't need to get into. But, and there's always a threat of a lawsuit, too.
Yeah.
I mean, that's always hanging over you, too.
It is. I just always approach my own practice and being on call, and I have 3 amazing partners and a nurse practitioner partner, and we all cover for each other, and I'm very fortunate. That's what I tell the residents is that, you want to have, in academics, you want to have great partners, you want to have a great chairman who supports you, and I'm very lucky to have that. But I tell you, my goal is to when I'm on call or when I'm doing operations is I want my partners to know their patients are well cared for, because they sure as heck do a wonderful job of caring for my patients. Like right now when I'm off on book tour, right? There's a sense of this mutual trust. And I just think that, if you treat people and patients, I just talk about the Jack and Fair rule. Those are my kids. It has to pass the Jack and Fair rule. If I want the care rendered for them to be the same as it would be for my kids or for any of my partners' kids. And all of us buy into that. And all of us are very much invested. And I would say that, not just to be Captain, Vanderbilt pitch, it's the same for the team here at WashU. It's the same for, the team in Boston, the team in Stanford, the team at Duke. I mean, there is this mutual sense of, we're in this together to care for the patients in as best a way possible. I believe that we get along so well because we've lived the experience of taking care of kids who get well and kids who don't. Parents who are grateful to you or never want to see you again. Hours spent in the operating room negotiating with a higher power for the bleeding to stop, the tumor to finally peel out, or the brain swelling to go down. I'll do whatever you ask, God, please. Just help me get this thing out.
Appreciate that. We're going to end on that. Dr. J. Wellons, thank you so much for your time.
Thank you so much, Victoria.
And for enlightening us. And good luck with the book. It sounds like it's off to a great start, especially with that Instagram network that you've got going too.
Well, it's wonderful. Social media has been a great thing. But thank you for letting me be here. Sure. And it's an honor to talk about the patients and the colleagues. And I've loved it so much. Thank you.